Welcome, doctors. Let me ask you something. Have you ever listened in on a call at your practice or hospital that made you cringe a little? Maybe the representative sounded robotic, maybe the information wasn't clear, or worse, it was wrong. You know just how quickly one bad call can break a patient's trust. That's exactly why at Staffingly, Inc., we treat call quality as a living, breathing process, not just a checkbox. Every single call matters, because on the other end of that line is a patient who's depending on your team for empathy, accuracy, and professionalism. Now, you might be wondering, how do we actually make sure these calls are top-notch? And no, it's not Big Brother watching. It's a secure, HIPAA-compliant system that checks for things like tone, friendliness, accuracy of information, whether the patient's concern was fully resolved. Every call is reviewed against a scorecard that's customized for your practice. But here's the real magic: the feedback loop. Instead of waiting for mistakes to pile up, we catch small things early. Calls get monitored, scored, feedback is shared, training is updated, and the cycle repeats. Over time, even a brand new virtual medical assistant or AI medical receptionist can go from just okay to outstanding. Let me paint a picture for you. Imagine you're running a small dermatology clinic. Your virtual medical assistant is taking patient calls. With Staffingly, calls are reviewed weekly, real-time coaching happens if something feels off, and if patients keep asking the same question, the script gets updated. You don't even have to think about it, it's already handled. Now, flip to the other side. Let's say you're managing a large hospital system with a 10-person outsourced call team. In that setup, we're doing daily call sampling, checking triage scripts for urgency, sharing weekly performance dashboards, automatically scheduling refresher training for anyone who needs it. That way, whether it's the first call of the day or the very last, patients get consistent, professional support every single time. Here's a real-world example. A pediatric clinic noticed parents were confused about their new vaccine scheduling process. Within a week of QA reviews, our team flagged the issue, updated the script, retrained the staff, and suddenly those calls were smoother. Parents got clear answers, no-shows dropped, and trust went up. That's the power of catching things early. So, what's the takeaway? In healthcare, the quality of your calls says a lot about the quality of your care. With Staffingly, Inc., you don't just get someone to pick up the phone, you get a full quality assurance process that keeps improving week after week. Safe, scalable, and efficient. Doctors, if you're ready for patient calls that consistently reflect the level of care you provide, let Staffingly handle the quality so you can stay focused on medicine.